Well, hello everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. And my name, for those who don't know me, is Dr. Dada. And I help people with joint pain become pain-free and people with autoimmune disease get their immune system back on track. So I have a guest for you today. And it's been a while we've been thinking about mental health. And I have the perfect person to really help us with the challenges that we're dealing with mental health. So I have my dear and very good friend, Prisca Nwizubo, who is an advanced registered nurse practitioner that specializes in mental health. And so over 15 years of experience in the field, she's really been dedicated, for as long as I've known Prisca, to really supporting individuals as they're trying to navigate kind of the complexities of mental health and challenges. So she founded Optimum Mental Health Clinic in Renton and is committed to offering just the service that she offers to patients is just on another level, and it's comprehensive with multiple services in her clinic. So I am going to let Prisca take it from here and do an intro about why she does what she does, and then we have an interesting segment for you today. Thanks, Prisca.
Well, thank you, Dr. Dada. It's a pleasure to be here with you. Like you said, yes, we're not only colleagues, but we're also dear friends. So it's been a pleasure. So yes, my name is Prisca Nwizubo. I'm a psychiatric nurse practitioner. I own and I'm the owner of Optima Mental Health Services, an outpatient clinic where we treat all spectrums of mental illnesses. Yes, like Dr. Dada said, I do have well over 15 years of experience in this area. It's a passion of mine that we take on every day. Yeah, so I'm here to talk about specifically my one of my specialties, which is depression.
Okay, thank you, Prisca. So, there are questions that people have about depression, right? And I think because the word is used so loosely, people actually want to know if depression is kind of categorized as a mental illness or is it just the blues? Any thoughts about how people can kind of think about this a little bit?
Yes, depression indeed is a mental illness. It's a complex illness that affects people's mood, affects their behavior, their thoughts, and affects their overall lifestyle. Symptoms ranges from anywhere from extreme sadness to feelings of hopelessness, feelings of loss of interest in one's enjoyable activities. It affects family. So it is actually a serious illness that does affect actually millions and millions of Americans across the Americans and across the globe.
So when you say, when you kind of mention that, depression is kind of a loss of joy and some of the symptoms that you mentioned, I could say that happens to everybody at some point or the other. So, I'm suspecting we're talking about the fact that it's persistent. Can you tell me how you differentiate from I'm having a bad day into when does it kind of cross over into depression?
That's a really, really good question. So, yes, you're right. Everyone do experience one point in their life symptoms of depression. Now, what differentiates that from somebody who may have clinical depression? So first of all, there's like situational depression, which might be something that's relatable to a lot of people. For example, you lost a job and that led you to feeling depressed about that. So understandably. And then there's this clinical depression or chronic depression. This is whereby patients are suffering from depression without without actual trigger or an event that happened, they just are depressed. In the neural system, we do have our neurotransmitters that are responsible for our mood regulations, such as the serotonin, dopamines, and norepinephrines, and glutamate, and so on and so forth. Some people's their distribution of those neurotransmitters may not be as adequate or may not be recepted effectively. So therefore, they do experience more of a chronic depression. And even then, that depression can even get exacerbated by situational, such as, again, like loss of a job, loss of relationship, and so on. Yes.
Yeah. Okay. So yeah, so one can have depression, but it sounds like it can also be triggered, right? It can also be triggered by kind of situations in life that can kind of make a bad situation worse.
Absolutely. Absolutely.
Is there a time, can you outgrow depression? Is there a time when we can say, okay, you're too old to be depressed? Does such a thing exist?
That's unfortunately not the case. You know, to say outgrowing depression, unfortunately, you know, people, I treat patients who literally will say they do not remember their life without ever being depressed. So for as long as they're able to retain their memories, they have always felt depressed, right? So that is very, very unfortunate. But depression can also happen at any time in age. So therefore, so meaning depression can happen in older age, even to those who never experienced depression before. Typically, chronic depression tends to show up, you know, right about maybe early 20s is when it sets in motion. But we do have patients that have experienced depression all the way going back to their early childhood memories, right?
Wow.
Unfortunately, yeah.
Yeah, that can be very difficult to deal with. So while we're talking about that, right? So it seems like nobody is really spared, right? So at any time in life, at any age in life, and there are people who kind of say that they cannot remember a time when they have not been depressed. So then the question is, and I think that most people understand that there is medication out there for depression. But the question is, are there other options though, other than medication? Are there other options for people kind of struggling with depression?
Okay, I'm smiling because you're kind of like talking about kind of right above my alley, right? So my way, the way I approach treating my patients is like, first of all, I don't like the idea of like the notion of like there's nothing we can do for you. I think hope is something that is vital to survivability. It's vital to humanity. So we must always have hope. So yes, I am always in search of what other options are available. And for that, and that search has actually led me to discovering another option that is not medication, because there are unfortunately people who are non-responsive to medication. So we'll call them treatment-resistant patients, you know, with their symptoms. So there's a treatment option called TMS, which stands for transcranial magnetic stimulation. And this has been a game changer for a lot of patients. I mean, we're talking patients who were basically told that tough, that's life, you know, just kind of deal with it. Or they had to keep taking multiple medications in order to get some kind of partial efficacy from them. And then while in the meantime, dealing with a lot of side effects, right? Because we know what medications do, especially when there's a polypharmacy involved. So TMS has been an answer to a lot of prayers to such someone like myself, who is so dedicated in treating patients with depression, and also for patients who are getting a chance to live, something that most of us would take for granted, especially if we don't have, depression disorder. But it's everything. It's again that hope that I talked about earlier. To be able to get up and partake in life. It's a priceless gift. So yes. So there are some lots of other options, and we can talk more about TMS later if you yeah.
Yeah. So I kind of piggyback on what you're saying is the hope aspects, right? And a lot of people kind of give up on medicine, and give up on traditional medicine a little bit, I think, because they've tried 3, 4, 5, 6 drugs. And because of the side effects, they really couldn't tolerate it. So, you and I work together in a clinic called Eastside TMS and Wellness Center. And in that clinic, we've treated people with TMS. And would you like to share kind of maybe an experience that the patient that has been kind of dealing with depression medications had with TMS? Any stories or anything you'd like to share on that?
Yes. So if we don't probably have enough time to share the amazing recovery stories, but I will keep it to, I'll give you one example. So this is a patient that I've been working with for at that time probably I would say like over 3 years. She was on up to 6, 7 different medications.
Wow.
So what you have to understand is sometimes the medications you take causes side effects, and those side effects now need medication to treat the side effects that you're getting. So, but this patient said to me, so she was actually planning her wedding, and she said to me that, she does not want to just look happy. We know brides, that's their special day. Everyone is there for them. Yes, the groom too, but the bride is, and bride has a smile on her face and she looks gorgeous. And, so she says to me, Prisca, I don't want to just look happy. I want to feel happy. And let me tell you, I still get chills. This has been about maybe 3 years ago. I still get chills thinking about that moment. Can you imagine something that we think is a God earned, right?
All right. Yeah. You take it for granted.
To be
you take a lot of things for granted.
Yes. She says she knows how to play the looking happy, but she wanted to participate in her own wedding. So, again, she met that criteria for TMS. So we talked about TMS, went through the consultation process, went through the insurance process, and got her approved and started the treatment. We did this, started doing the treatment, and so the whole time I've been working with her because I've been managing her medications. I have never spoken to her therapist. I know she has a therapist that she sees every other week or so, but I've never spoken to him. And I got a call from her therapist, and he was shocked. He was confused. He was like, who is this person in his office? And he thought he had to call me to ask, what have you done to my patient? Our mutual patient, obviously.
Just such a change.
The change. I mean, it was such, again, like as providers and especially mental health providers, when our patients are doing well, it's like, it feels like it's the biggest win for us because we know that the challenge of what they go through just to be quote unquote normal and to be active participating member of the society. So that story sticks to my heart. But I tell you, I have multiple, numerous stories. But here's also a kicker. So because it has been over a few years now, so some patients that do go through TMS treatment, sometimes they may need a touch up, a redo, like maybe a year later, maybe or so. But then you have these other group of patients that one treatment somehow like it just did it for them. And so I'm happy to actually report that I see her every 3 months just for med check. And but she has never gone down that level that she was at.
That's amazing.
That is, so that is amazing. So yes.
Wow. So, so Prisca, I think you and I are going to have to meet like once a month, right? And where we have kind of this wellness, because people are really struggling, I think, with mental health. So I think once a month, if you want to tune in, Prisca and I will be having kind of mental wellness, how to be well, how to be happy, right? What we can do for ourselves and what resources are out there for people who are kind of struggling with mental health, especially depression. So Prisca, we're going to do this again in a month. So every month we're going to do this, and I think people are going to have lots of questions about TMS. What is it? How does it work? Can I do it? Will my insurance pay? All kinds of questions. So we're going to have people send us questions so we can answer them. But between now and then, if anybody wants to reach out to you to work with you, how do they find you?
Yes, we are all over social media. Our clinic name is Eastside TMS and Wellness Center. Yes, I also do own another clinic, which is we call it sister clinic, Optima Mental Health Services, which again also treats mental health illnesses. But we dedicated a full clinic for the TMS treatment because it's such an important treatment option for patients, so that we created its own setting for it, almost like a spa-like setting, because I feel like if you have to struggle with depression for as long as you have struggled, and you deserve to be pampered, and I'd love to see you get better in a very luxurious setting. Okay. All right. But yes, we're on social media, Eastside TMS and Wellness Center. Our website is eastsidetmswellness.com. And I believe we should be able to send.
I'm going to actually put at the end of the show notes, we're going to have the links
to all our
websites,
yes,
the phone number.
Yes.
And for both clinics, the Eastside TMS and Wellness, as well as Optimum Mental Health, and both are in Renton.
And both, yes, we're
in the Greater Seattle area.
We're in Renton, just right off of 405, so very easy access to people living on East Side, people living on the South End, people who live in Seattle. So it's very easy to reach us.
Okay, wonderful. Prisca, thank you so much for coming on the show. This was so informative and helpful to our viewers. So we'll be getting questions, and then we'll do this again in 4 weeks out. And then, so for anyone out there, if you think this video has been helpful, please like it, please share it. Subscribe to our channel, Healthy Joints, Healthy Life. There's so many guests that we have that are going to really kind of feed your soul, right? And so the plan with our series with Prisca is really going to be mental wellness and how we can make sure that everybody is thriving. So thank you so very much for listening, and we'll see you guys in another few weeks.
Bye-bye.